Hi, Steve. It's Dr. Buford. I'm here with the rest of the shoulder chain. We're just getting started on the right shoulder. We're looking at it from the back to the front. Everything you see is magnified 30 or 40 times on the screen. Your rotator cuff's definitely torn, which is what we expected, so we'll be fixing that today. What we're looking at here is we have to decide what to do with your biceps tendon. I'm going to shave a little bit of this rotator cuff here. And now I can look at the biceps and decide. Yeah, we're going to be doing a biceps tendinosus as well, so I need a stitch for that. And then we're doing that because this attachment's loose here, as you see. So we're going to go ahead and read that. It's really what we call almost a type 3, or almost a meniscoid with a bucket handle tear. But we're just going to go ahead and read it like that. This is the supraspinatus portion of the rotator cuff here. It's torn. So now, you ready? Okay, hold the camera, please. We're going to go ahead and take a spinal needle, and we're going to pass that through the biceps tendon here in just a second. Right through the biceps. We're going to pass a black wire called the Suture shuttle through that. Pass the needle through the biceps one more time. That looks like a good spot right there. And now we'll go ahead and pass that wire through again. Now the secret here is we're going to grab the wire, but we're not going to pull it through the cannula yet. We're just going to hold it right there. And now we're going to reach behind the biceps to retrieve it here like this. Okay, so now we've got the suture passed twice through the biceps. We're going to go ahead and cut the biceps now. Okay. And now we're going to have a look around the rest of the joint on the inside to see if there's anything else we need to do. Okay, here we are looking down the front of the shoulder. Fine. Look around. Look towards the back. The anatomy here looks pretty good as well. No signs of any significant arthritis in the joint. Humeral head looks good. Hold the shaver, please. so we're looking at the tear in the tendon, and we're just trying to decide where we're going to place the suture anchor. Let me show you. There's the articular surface. You can see how that runs horizontally across the screen there. So we're going to place our anchor down. I don't want to take away any extra tendon. We've taken away all the tendon that was torn or didn't look healthy. So if we place an anchor down right about here, we can get this down to the bone. We'll go ahead and take a scalpel and pull that. And then we're going to pass a guide down, a drill guide, or really a suture anchor guide, because we don't have to drill. There's the guide. Okay, so once again I want to check and make sure that I'm where I think I am. That looks good. We're going to bring this back just about 5 to 7 millimeters about here, and then we're going to go ahead and take our anchor, put it in that guide, and then we're going to look on the screen and we'll just tap that down. All right, I'll record it. Okay, so we've got our anchor down in the bone. You can see there's 3 separate suture pairs, different colors here. There's a solid blue, blue and white striped, and black and white striped. We're going to take the solid blue one here. We're going to hold the cannula and bring that into the cannula on the right side of the screen. You can see it right there. And so now on the left side of the screen, we're going to pass an instrument called the suture hook through that blue cannula there, and we'll take a grasper on the right. Here's the suture hook. Okay, so you're on the scope. So we're going to reach in here. Here's the tear. And what I'd really like to do is make sure that we're getting this prepared anatomically. Which means I'm going to want to pull this down like that. So we're going to start back here. We're going to pass just like that. We're going to feed that relay through and retrieve it here. Okay, now as we pull slowly, you'll see how that suture comes underneath, comes out right there. We'll get the partner suture here. Just like that. And now we're going to decide what sutures we're going to use next. I'm not going to tie that right now because it's going to block our vision if we tie that and close down the tear. So it looks like the next sutures is black and white striped one. Take that here. Okay, so now I've got 2 out of 3 sutures passed, but not tied. And now we're going to get the final suture that we'd like to pass underneath. It should be this blue and white suture. Notice we're taking this one out posterior or to the left. We'll pull out the anterior cannula completely. Just pull it out. And now we're going to use the suture hook that curves the other way. You can see on the screen there. And now we've got to decide where to pass this. So it looks like that's going to be pretty anatomic. Come down about here. Okay, so here we are showing you our 3 sutures tied to fix the cuff. We're going to make a little hole in the bone later, but first we're going to tie the bicep sutures. But that looks real good. See how that's anchored the cuff down to the bone. Now the bicep sutures are going to be up in this area, and we'll get those. There's one of them right there. We'll get those. Well, that's not one. It's going to be back over here. We'll get those retrieved in just a second here. Okay, so what we're going to do now is make some little holes in the greater tuberosity to release some of the bone marrow elements that help with the healing process. We're going to go ahead and tap down into the bone here. we have to do. We don't want to obviously impact or go into the bone anywhere near the anchor, but that looks real good. There's our repair, our bicep sutures over there, and that looks real good. So we're going to finish up here and get you back to the recovery room shortly. We'll go ahead and turn off the pump and see if we can see some of those marrow elements coming out. Sometimes when we turn the pressure down, we can even see that happen. You see the shaver here? Yeah, so those holes in the bone are right down here, and we'll start to work in just a minute. So good luck to you now. Bye-bye.